Today we're going to take a 7-site skinfold measurement. Skinfold measurements are widely utilized to assess body composition and is a simple and inexpensive way to measure body composition. Today I'll be using the baseline skinfold caliper instrument on my client. When you begin, you always want to make sure you have permission to touch your client. After that, for the tricep measurement, you want to locate the midpoint between the acromion and the aliquoron process. Make sure that the arm is held freely on the side of the body, and you want to make a vertical pinch. And you're going to give it a little shake to make sure the separation of the fat from the muscle. And you're going to take the measurement of the caliper, and then you'll release, but you're still going to be holding the pinch while you release. And then moving on to the subscapular site, we want to make a diagonal fold about 1 to 2 centimeters below the inferior angle of the scapular. Again, you want to shake to separate the fat from the muscle. Then take your measurement, you're going to record it, and then you'll release the caliper, and then you'll release your pinch right after. To begin, always be sure to have permission to move clothing blocking the measurement site. Then you will follow to make a diagonal fold about 45-degree angle from 1/3 of the distance between the anterior axillary line and the nipple. You'll pinch, take your measurement, release the caliper, and then release your pinch right after. I didn't mention this earlier, but each measurement that you'll take will be on the right side of the body. It's just a standard way to perform the test. Now for the mid-axillary, you want to make a vertical fold between the mid-axillary line at the level of the xiphoid process, basically the middle of your armpit coming down, and it will be across from the subject xiphoid process at the end of the sternum. My client will put her arm, as you see, it's going straight up. That is the wrong way to do it. You normally want to place your client's arm across her body, resting her hand on the left side of the shoulder to have better access to the region, because having her arm like this will kind of alter the results a little bit, but that's basically how you would perform this one. The next measurement will be the superiliac, so we will make a diagonal fold along the line of the iliac crest. You'll locate it by finding the hip bone, and you'll measure about 1 inch above the crest, and it's going to be diagonal, so make sure it's a diagonal fold, not vertical, just to make sure, and then you'll go ahead and take your measurement from there. For the abdominal site, we're going to make a vertical fold about 2 centimeters to the right of the umbilicus, which is basically the belly button, and then you're going to grab, you'll shake, and then you'll place the caliper vertically also. You're going to read the measurement on the scale, and then you release the clamp, and then you release your hand. For the last measurement, the thigh, we will make a vertical fold midway between the inguinal crease, which is the groin area, and the patella, which is the kneecap, on the right thigh. And for this one, it's a little tricky to separate it from the muscle, but go ahead and have the subject rest most of their weight on the left side of their body, and then you'll go ahead and take your measurement from there as well. And after your first readings, make sure you rotate between each site for each trial. Try not to repeat the same site for each one twice in a row.